Hi everyone. Very delighted to be here with all of you and presenting with John Williamson and in the voice of the great group that wrote a really impressive draft for this focal question 2. What are the most effective systems, strategies, interventions to assess and address the immediate needs of children outside of family care? Okay, just this is obviously a draft, and so we are very open. And I will mention during the presentation that there are areas that we see that there is some weaknesses, and that we are really looking forward to hearing from you, and even after the summit to enrich and to have a more polished and better document. The document starts with, that is in your package, starts with an introduction that we thought it was necessary to understand and to read the document more to contextualize this document. And one of the first things we have to acknowledge is the scarcity of evidence to answer this question. And there is a lot of experience, there is much experience there, but we can't say that there is a lot of evidence. And some of the evidence that we have reviewed, there is evidence that is strong, and there is other evidence that is not that strong. We also have to think about some limitations for collecting evidence, and there are some ethical and technical limitations for research, especially in the first stages of emergency. Like one of the clear examples is if there are children that are starving, we cannot have randomized controlled trials and leave them starving as a control group and see, for a few months, and then we'll see what is going to happen there. There is also, we have to see that there is a big diversity of these children. And we have been very good students, and we have looked into the research of the four categories of the 4 vulnerabilities. But as the previous previous group has mentioned, there is a lot of overlap of those categories. And there are children that one day are not on the streets, but the next day they are, and one day they are in an institution, and the other day they are associated with an armed group. And so there's a lot of complexities, and we cannot really read this paper without framing this research, this evidence that exists, without taking into consideration these complexities of these children living out of family care. A child who is living out of family care can be a lot of things, and we have mentioned some of them in the paper. And also the context, because we can't look at children out of family care in the same way in northern Uganda than in West Africa, in Lofa County in Liberia, or in Bujumbura, in the capital city of Burundi. The contexts are very different culturally, socially, and that also implies that if we do research in one area, the results are not necessarily translatable to another area. And that is going to be a challenge to continue building evidence. So as I said, we talked about 4 vulnerability cohorts, as we were told to: separated and unaccompanied children in emergencies, children in institutional care, children on or off the streets, and child-headed households, and also children who are trafficked or in child labor. The way we approach this is we looked into policy and practice guidance employed by operational actors, and are addressed first, and then they are followed by research and research gaps. So we had to also add some documents that were suggested by the members of the group to be reviewed, and many of those documents were more they were not evidence documents, but they were more guidance that practitioners are using, and they are very well accepted by practitioners and policymakers, and that have to be also taken into consideration when we look into what is really happening in the field. And one of the things that I have to mention is when we try to answer the question, we actually not completely answer the question, because when we look at immediate needs of children and immediate response to address those needs, we also have to look at mid-term and long-term ways of addressing those needs. So there is a lot of overlap. To complicate more things, there is a lot of overlap between question number 2 and question number 3, that is the group that is going to present tomorrow. And I have to say that some of the things that I read in the document many of them are complementary, and they will help also to answer the questions that we were assigned to. The paper talks first about prevention, and we thought it was very important to talk about prevention because any successful child protection system begins with prevention, and if this is not addressed, we can't really talk about addressing needs. It's essential part of identification of needs and addressing the needs of the child. And in fact, that is going to be also important to look into prevention of secondary separation, because many children who have been separated can be separated again if there are not measures in place to avoid that secondary separation. Unfortunately, we have to see that there is insufficient evidence on the root causes of child-family separation and how to prevent them, which is probably the way to start with. There are a lot of different livelihood strategies that families employ, and many of them end up in family separation. There's a lot of internal migrations internally, like they send children to the capital city to have an education, or the family entirely goes to the capital city, and then there are problems there, and the separation will occur there. Children will end up on the streets or situations of child labor. It will be important to understand with these livelihood strategies to be able to address them and to prevent family separations. We did find some evidence that interventions that build on existing household livelihood strategies when mothers are direct beneficiaries. If we work directly with mothers to help the livelihoods, we found some evidence there. But we have to mention that poverty is a major cause of separation, and I think that has been one of the things that has been said today several times, but not exclusive cause of separation. So it's one of them, but it's a very, very important one. And interestingly enough, we see that practitioners working on reducing child vulnerability and those engaged in more economic development, they have different expertise, but they are not necessarily working together. And that's becoming one of the major priorities, to combine and make people with different expertise together to prevent separation. A key prevention-related research question is how early prevention can mitigate stressors on families and strengthen their extended support systems. And also research on how to effectively integrate child protection and child participation into livelihood strengthening programs, and the scale up of these programs is going to be a priority. We finally, in the area of prevention, we think that we need also more research on the big projects that has happened in several countries, particularly in Mexico, Brazil, on conditional cash transfers, and see how those programs have been successful or not in preventing family separation. So now to talk about the four vulnerabilities, I'm going to talk first about children who are separated or unaccompanied as a result of conflict or disaster. And just to remind the introduction of this paper, we have here a girl who has been separated because of conflict. But actually this girl is also a refugee, and is also a single-headed household. She's 16 and she has that little girl. But she's also what they call Malaika in some of the refugee camps, which is an euphemistic name for a sex worker. And in that particular camp where I took this picture, there were 200 of them. So we say that in every major displacement of population, there is going to be a percentage of children that are going to be separated. And you have there some evidence about that. Those percentages are disputed, but anyways, especially when there is war, they could be as high as you see there. Child protection in emergencies relies heavily on NGO and UN guidelines and good practices tools. So those guidelines, in particular obviously the UN Convention of the Rights of the Child, but also the guidelines for separated and unaccompanied minors, even if they are not evidence-based documents, they are very much experience-based documents that have a very common acceptance by all the practitioners and people in the field. What we know also is that why we are going to look into separated children and why we are going to give them priority is because we know that children who are with their families, and obviously we all think about it, but we know for research and we know for sure that children that are within their families, they fare better the difficulties that can happen in emergencies. Nevertheless, we have to say that not always that there are distinct needs and challenges for children who are in families and outside of family care, but that not always is uniformly they are not always uniformly at greater risk for some adverse outcomes. Some of these children who are out of family care. Children who are separated, there are many kinds of them, and obviously some of them are children associated with armed groups and armed conflicts. And what we know also for research, and one of the reasons why these children are more vulnerable than children who are with their families is because they miss key life cycle milestones. They lose on their academic or education achievements, and they also lose on they miss possibilities on financial, how do you say that, achievements also, or in their lives. What it is commonly understood is that we need to have, for children who are separated, we need to promote a sense of safety, normalcy, a sense of self and community efficacy, connectedness, and hope. And obviously, family tracing and reunification. This is going to be a priority, and it's a priority for humanitarian agencies and for government agencies and for people in the field. And we have proof that family tracing and reunification is not only a priority, but is possible and is effective. And we have good data about that. After the tsunami in Aceh, more than 80% of children were reunified with their families. We have reunified thousands of children after the conflicts in West Africa, in Sierra Leone, in Liberia, and lately in Haiti after the earthquake. The restoration of education and the school community is essential for these children to be reunified, to be reinserted in their communities. And also one of the interventions to address the immediate needs of children that has been very commonly used is child-friendly spaces. We have also seen that there are significant gender distinctions, and children out of family care, girls and boys, have different risks that have to be looked into. In particular, for example, the risk for female adolescents to gender-based violence. There are many needs on research that have been identified. Evidence-based on efficacious psychological intervention is weak, and despite the fact that the field has improved and there has been many more psychosocial interventions. And also we have to do some research on methods to prevent family separation and secondary separation. And in particular in child-friendly spaces, that, as I said, something that is an intervention that is very commonly used in the field. There is actually not strong evidence on the outcomes of those child-friendly spaces. We did see a couple of studies, one particularly in Uganda, where the children had better outcomes in their mental health than children who hadn't been in child-friendly spaces. But still there is a lot of research being needed. Particularly for children in institutions, and this is an institution, an orphanage in Burundi. Yes, only 5 minutes. We have to cut here. Family-based alternative care, when well implemented, is preferable to institutional care for their long-term development and social integration. But nevertheless, and we know, residential care centers grow in emergencies like mushrooms. And this is something that I think this morning it was Jacqueline Papa who mentioned that was one of our question research is why we know this is not the best way to move forward, why these residential cares are mushrooming in times of emergency. The Bucharest Early Intervention Project has already been mentioned, and you know about the evidence that demonstrates that institutional care is probably not the best way to move forward with for care for children out of family care. Nevertheless, one of the things that we have seen find evidence of is that we can improve outcomes for children in residential cares if we improve those residential cares. But the big question is, is it really worth it to invest too much money in improving residential cares when we know that they are more expensive and we have evidence that they are more expensive instead of using those resources and scarce resources that we have more into family-based or interventions to address the needs of children. One of the biggest problems for children in institutions is obviously figures, and that has been mentioned several times today. We don't know how many children are in institutions today. There are some figures from UNICEF that said around 2 million children, but we don't have really good data. We really don't know. We don't even know how many centers are. There are in few countries, in some countries, where there is some data, and we are going to encourage governments to have better data, but not having data, and that was mentioned also before in the previous group, makes children invisible. And if they're invisible, we can't really know what's going with them, we can make accountable the centers, etc., etc. Well-designed residential care may have a role in providing interim care, and we saw some good results for example, in Sierra Leone, when children who were associated with armed forces and armed groups were removed from military structures and they were put in place very briefly in interim care centers, and most of them were able to reunify with their families afterwards. The interesting thing is that children who are separated and they are in residential cares, most of them have parents, and that's the good news. Some of the studies we have seen is that around 80% of children of those residential cares in few countries have actually parents, and they are there for other reasons. And we need to know why are there and how to address those ones. We need to help countries with evidence to implement the UN guidelines for alternative care of children. And this is from Côte d'Ivoire, children on or off the streets, right? This is probably an area that we have seen in our paper that needs to be strengthened. And I've seen also the next group who is going to present tomorrow that have found evidence of common elements that have to be included in programs for children on the streets. They mentioned about framing the program, providing information, building skills, coping skills, building social support, and removing environmental barriers. But as a matter of fact, what we see is that there's an increased number of children that are being forced on the streets as a result of poverty, abuse, conflict, trafficking, and HIV/AIDS. We also found that there are three socioeconomic aspects of poverty and social exclusion that are mentioned. There were poverty and social exclusion, family dysfunction, and high failure rates in schools, and child-adolescent labor. But the other thing that we also know, as when we talked about the residential care, is that those children who are on the streets, they also do have families. They visit them at night, or they are in contact with their families sporadically or more or less sporadically. We need to understand the reasons for a particular child-headed household and ensure that they do not disrupt support being provided by the extended family or community. One of the things that has been recommended is that agencies that work with these children, they don't get a high profile, and then they could disrupt the actual support that these children receive from the community or from their family. Save the Children have also saw some innovative assessment approaches that include the children's in the science and conducted research. Anyways, successful programs link participants to economic opportunities, but also help participants maintain sustainable livelihoods by addressing various interdependent development needs. And we have found a lot of needs for research, as you see there, written in that long paragraph. Psychological impacts on children who assume care responsibilities for ill and dying parents and siblings, research on prevention. We have the lack of studies using experimental designs with random assignments or quasi-experimental designs such as propensities for matching, etc. Just very briefly to finish, children who are trafficked or in labor. And here the figures are quite staggering, and we also heard them this morning of children who are subjected to work and to the worst forms of child labor, including also child soldiers. What we do have there is we do have some operational guidance, like for child labor, for assisting also traffic victims. And also we have the Paris Principles and Commitments, which is also the guidelines for the reintegration of ex-combatants in their communities. And those good guidelines and operational guidelines are also combined with rigorous and sensitive quantitative studies that complement the information derived from these documents, as well as agency reports and qualitative studies. Any action with children who are trafficked or are in child labor, they need to engage communities. They need a strong community participation, like basically probably all the programs that work on children out of family care, as we need also child participation and quality child participation, engaging and hearing and listening to the voices of children from the inception of the programs, being child-centered and were contextually grounded. And as we mentioned also in the introduction of this paper, government engagement is absolutely essential, and we have to build upon indigenous resources. As we said, also engaging with the communities, but any indigenous resources that need to be identified. And we need to avoid some Western ideas, some Western models like trauma models, and not try to use models that are not going to be contextually usable. And finally, research needs. As in every other single category or group, we have found many gaps. Some of them were pointed out by many of the papers that have evidence, and they said this is the evidence on this area, but we need to do extra research and we need further research in these other areas. We need studies with comparison measures and larger sample size and power calculations to verify guidance assumptions and program effectiveness determinations. Outcome studies on informal foster-age systems and critical analysis of outcomes of children formally and informally placed in foster families. Enforcement and training programs for police and inspectors at borders and immigration offices to address trafficking and child migration, among other ones. Thank you.
Incredibly comprehensive overview. Did you mention it?
And long, sorry.
No, this one. How many studies, how many pieces did you look at?
We didn't count them because it was over 100 that we didn't count. Because we were adding more and more along the way.
And I'm sure that there'll be some material that will come forward today. Any reactions, thoughts, comments on that presentation? Go ahead.
I like very much all papers and this paper, and just I want to contribute to should we somehow approach socio-political or societal context? Because I think, for example, when we talk about overuse of institutional care, at least in my region, which is to a large extent a symptom of this vicious cycle of helplessness, self-destructive behavior, and still populations are unable to control their lives after some very cruel experiment, which is not fully maybe evaluated. I do not want to become very political, but if we miss such issues, we become too opportunistic. And I don't know how to be politically correct, but Central Eastern Europe is failing with child protection, not because of financial problems. So again, we should speak about so-called conditioning, and when donors want to support governance. So I think it's my hypothesis would be that the challenge or obstacle in many countries of the world is opportunistic approach to human rights and child rights, leaving out, for example, right to development. So Article 6 of the Convention tells right to life, survival, and development. And when we see these support programs, sometimes development, especially emotional, spiritual, social development, is forgotten because we have to save children. I mean their lives, and I do not want to be cynical, I'm a medical doctor, but this is what happened to the Soviet Union, with all this narrow model of child protection. From that time we have huge numbers of children in institutions because they are protected there. So I think these are root causes, actually, at least in this region, but I don't know how to be politically correct in such documents. But I think it's, at least for us and this audience, it's important to see how deep can be these attitudinal or contextual obstacles. And this is why I agree with those who were speaking before about need of qualitative research. It's equally important as quantitative.
They make very important points. Eduardo or John, you want to respond?
Yeah, good point. Consider the socio-political context.
Yeah, no, absolutely. Yeah, I mean, this is why also we wrote the introduction there for exactly trying to raise the point you're raising. that any intervention has to be contextually sensitive, and that and we have to understand very contextually which are the causes of the separation of children. That can be many of the coping mechanisms and the livelihood strategies of some families in some countries are the ones who are really leading to separation. And those could maybe work in one country but not in another. Everything has to be extremely contextualized. You should have been in our group. Why you didn't work in our group?
Continue to contribute. Other comments, questions to this group? I was really thrilled to hear them start a session on immediate needs with the word prevention, which you might not normally think of. But you also mentioned that there is not as much evidence about what's effective. Do you want to comment any more on that? And where we need to go?
I'd be interested to hear from participants. I mean, it's challenging to do research on what prevents something from happening, measuring the negative. But I'm sure that there must be methodologies that are relevant and applicable and can be used. Longitudinal studies, I suppose. But I'd be interested to hear from participants.
Go ahead.
I'll respond to that part of it. I think in terms of prevention, and there was a lot of discussion in the group about whether to include prevention, but it was so compelling that we really had to. So I think also, particularly in terms of short-term intervention, it precedes it so closely. In terms of measuring it, yes, it's difficult to measure what didn't happen. It's kind of like, I think the discussion earlier this morning is, looking at the consequences of something if you don't do it. So there are tools for looking at prevention, particularly in terms of trafficking prevention, child labor prevention, especially, looking at interventions of immediate need. It's not always an emergency situation, but once it's discovered, a worst form of child labor, whether it's in, hazardous agriculture or mining, there is an intervention required. But in terms of prevention, we try to develop tools for criteria to be able to identify, and again, this goes back, I think, to the identification of the children who are very vulnerable or very liable or at risk. And some of those criteria do have to do with poverty levels. It does have to do with whether the siblings are also involved in child labor or worst forms or have been trafficked. And a very serious part is also prevention through economic empowerment in terms of trafficking and just awareness raising about the dangers. If for example, an advertisement or a lure to come to another country to get a job, and people realize that they end up in an exploitive situation or traffic situation. So I think it's just a kind of awareness information, as well as community-based learning on what the different tools are and abilities to identify children at risk.
Other comments? Before I ask you to fill out your green cards for our 5 minutes of silence, I do want to ask, was there more evidence in one particular vulnerability group regarding immediate needs?
There's not enough research probably on children in institutional care, but there's probably more research in that area than in others.
Maybe also the papers we were reviewing, because what we found is probably the children, street children, was probably we read some of the evidence there, but maybe there's more evidence about street children that we have reached that part.
There's a fair amount on children affected by home conflicts, separated children, but I don't think we actually did a count, but I'd say probably more on children institutions.
Because it would be interesting to look at that. You want me to comment?
You mentioned in there that children in these situations have a lot of needs, and there are, I thought particularly of mental health and substance abuse problems that are often common. And I mean, would it be appropriate for this chapter or this paper to sort of identify a couple of assessment tools that have been widely validated for use in international situations that can be used to do mental status exams or substance abuse screens or things like that? I don't know the whether these things exist, but and various other areas, or problem areas where sort of rapid screening assessment tools might be available.
Yeah, we did look into a couple of the tools for assessments. There is actually a new tool that was that is now available that was generated through the Child Protection Working Group, which is the emergency child protection assessment tool. Susan, okay, yes. So there are a couple of interagency child protection assessment tools for emergencies.
So we're going to move into just a few minutes. Julian, did you want to say something?
And on that point, one of the things we talked about was the importance of including multidisciplinary teams to go and assess children, so you don't have, again, a series of people going in and asking children traumatic questions. So if you can go in one shot, cover health and mental health and shelter and food and nutrition, that kind of thing. And that also toward building a mainstream, child protection in all sectors and all approaches. So if you're building latrines, you're actually considering the child protection implications for kids.
It harkens back to Jacqueline's presentation again.
And that's in line with something that was mentioned before on coordination also for assessments, and was not mentioned the clusters or OCHA, for example, in emergencies, to see who is going to coordinate and ensure that what Gideon's saying is really taken into consideration. Children are not interviewed 20 times.
So I'm going to go ahead one more time. Go ahead, sorry.
I just wanted to know if you found any of the, so there's been so much social protection research, particularly around cash transfers, if they made any conclusions in terms of child protection.
Actually, we pointed out as the need for research on that area. I don't think we did find any of those, though.
And I frankly don't think we delved deeply into the research because the cash transfers are being made to households.
But it's a very important question.
And in fact, we pointed that as an area of research that will be necessary for prevention. If the conditional cash transfers, and it has been massive, especially in Brazil and Mexico, including millions of households, if that has really helped prevention of separation, that's again a really challenge. And if someone can help us to look into that, because how to measure things that have not happened, basically.